Constipation, how to help your child become unstuck. Most kids will experience constipation sometime during their childhood, but occasionally it can become a recurrent and very frustrating medical issue for parents to deal with. There are many reasons for constipation. There's great variation in bowel movement frequency, so just because your child doesn't stool every day, it doesn't necessarily mean they are constipated. Children may become constipated due to lack of fiber intake. They may eat too many foods with high simple sugars, and not enough foods with high fiber. This is often the case when kids eat meals consisting of junk food, fast food, processed foods, etc. Not eating the recommended number of 5 servings of fruits and veggies a day can also trigger constipation. Not drinking an appropriate amount of water can contribute to constipation as well. Lack of sufficient movement or exercise can create sluggish bowel movements and constipation. Another very common reason children become constipated is because they hold their stool inside instead of passing it when the urge to do so comes. For example, children may prefer to play instead of taking the time to go potty. Or, they may have experienced pain from a prior attempt to go potty and because of the memory of the associated pain, they hold the stool inside. As a result, the stool becomes more hard in texture and more difficult to push out as more stool is added to the stool they did not pass yet. This creates a vicious cycle, making harder and bigger stools that are difficult to pass. The child's stomach will also hurt and become bloated. Sometimes there are medical reasons why children suffer from constipation. Treating constipation in children is not always easy, and there's no magic pill. With patience, mixed with love, understanding, and a strategy, treatment is very achievable. The first step to becoming unstuck is to clean the intestinal pipes. If you take the analogy of the intestines being plumbing pipes, then you first want to clean the drain. This usually means a bowel cleaning process using strong bowel cleaning medication or enemas. The second step centers around maintenance and preventing the pipes from becoming clogged again. You will be aiming your best shot at prevention if you can attack what caused the constipation in the first place. If the constipation is due to a less than optimal diet of fruits, vegetables and water, attack those areas by gradually encouraging consumption of the recommended amounts of these nutrients. To get the process going in a favorable direction, you may have to set up a reward system. Nothing fancy, but perhaps stickers that can be earned and redeemed for a trip to the park, to see a movie, or whatever you mutually decide would serve as positive reinforcement for a child who is old enough to respond to rewards. If your child produces a stool, reward him with a star. If he doesn't, provide verbal praise, pat him on the back, or give him a high five for giving it a try. Remember, it is critical to not be critical or negative, as this will block success. Big hint for success. Have your child leisurely sit on the toilet for 10 minutes after a meal if possible. Reading, coloring, or relaxing without being rushed helps a lot. The reason for this is that bowel movements are pushed forward with contractions, and eating can get the contractions going. So if your child is sitting on the toilet after a meal, whatever is closest to being ready to push out can be expelled with the natural waves of contractions without straining. Another big hint. Body positioning on the toilet matters. Studies are showing that passage of bowel movements can be a lot easier if children, or adults for that matter, elevate their legs. In the normal seating position, the intestinal pipe is kinked in an area that makes it difficult to pass stools. With a small correction in positioning, this kink can be relieved. For more information, check out this product that gets the job of relieving pushing and straining done. http://amz.to/1svxdvl, an affiliate link. Remember to consult with the pediatrician if you have any questions or concerns about the process, or if you are noticing something that does not seem right. Thank you for watching, and be sure to check us out on Facebook and like us at https://www.facebook.com/mccwe, and also at our website www.gr8merit.com.